I chose to do my research project on female juvenile delinquency. What are the causes of female juvenile delinquency and how can we prevent it? Female juvenile delinquency has increased drastically in recent years. We as a community need to come together to help these females and create some type of preventative program before it's too late. Minor offenses may mask serious problems that girls are experiencing. Running away from home and other status offenses such as truancy are major causes of girls' delinquency. Studies of girls who are chronic runaways document significant levels of a history of sexual and physical victimization. Females who have some type of mental illness such as depression, anxiety, bipolar disorder, as well as learning disabilities, have a propensity towards female juvenile delinquency. Research suggests that although their offense behavior may start off as minor and may not appear to be very serious, these girls may be escaping from serious problems and victimization, which in turn makes them more vulnerable to more victimization, and they may start engaging in other behaviors that violate the law, such as prostitution and drug use. If we could create gender-specific programs, we may prevent or lower the recidivism rates of the female juvenile delinquency. My first journal article is Female Juvenile Delinquency, Misunderstood by the Juvenile Justice System, Neglected by Social Science. The focus of this article was on the female juvenile delinquent and the juvenile justice system's response to females who commit delinquent acts. The study looked at and reviewed the strengths and weaknesses of the viewpoints regarding female delinquency. By understanding the difference between male and female delinquency, we could benefit by offering specific types of treatment to offenders. This study also found that while female delinquency follows a specific developmental course, there is a relationship between female delinquency and background of having been physically and sexually abused. My second journal article is entitled Hanging On by a Thread, Mentally Ill Female Offenders Involved in the Juvenile Justice System. This journal article focused on the female juvenile delinquent and mental illness. Females show a greater propensity towards reoffending if they do not receive the help they need for their mental illnesses or therapy to deal with any type of abuse they may have been a victim of. The author of this article recommended that we take the initiative to look at female delinquency and the basis that developmental, psychological, social, educational, and cultural characteristics play a major role in why females act in a delinquent manner. He also stated that it is important that we understand their family history, substance abuse, and mental health disorders and their relationship to criminal history so that this information can be used to guide the development of mental health interventions in the juvenile justice system that are more gender specific. My third article is Females in the Juvenile Justice System, Influences on Delinquency and Recidivism. This article is about the role that the mental health and family dynamics plays on the female juvenile delinquent. The biggest indicator of female delinquency was a diagnosis of a mental health disorder that showed aggression or issues with impulse control. The needs of females in terms of treatment, prevention, and aftercare differs greatly from that of their male counterparts. Programs for intervention should put a focus on factors that lessen the risk of recidivism. So in conclusion, although additional research is critically needed, it is clear that economic disadvantages, exposure to violence, experiences with physical and sexual child abuse, and the lack of positive parental supervision does have an effect on the development of the female juvenile delinquent. Early puberty, added with the stress from conflicts with parents and the involvement females have with male delinquents, is a risk factor that is unique to females only. Determining how the justice system feels about the detention of girls because community-based alternatives are lacking, we need to create programs that are gender specific to females because they have different needs than males. And this is my references.